Hello, this is Stephanie Zier from Healthcare Services at the Healthcare Authority. Welcome to the Healthcare Integration Update webinar covering changes coming in April 2016. This is training session 3 in the Healthcare Integration Update webinar series. The purpose of this webinar is to provide you with more detail about fully integrated managed care in Southwest Washington, which is the early adopter region, including behavioral health services only, and the impacts of these coming changes on how healthcare services are purchased and delivered starting in April 2016. This webinar focuses more specifically on the Behavioral Health Administrative Services Organization, also referred to as BH-ASO, coordination among regions, and gives examples of the letters that will be mailed to individuals with Apple Health starting in December 2015. Information regarding any future webinars will be shared roughly 2 weeks prior to the scheduled webinar. Additional webinars will cover specific aspects of healthcare transformation to provide you with the tools to assist Apple Health individuals. To recap from the previous webinar in this series, there will be different enrollment pathways based on program type in April 2016. The table on this slide is a helpful way to envision enrollment pathways for individuals with specific Apple Health benefit packages. Most Apple Health Medicaid clients will be enrolled in fully integrated managed care program. Clients who are either exempt from managed care, such as individuals on Medicare, or who are allowed to opt out of managed care, such as individuals who are American Indian or Alaska Natives, will be enrolled in the Behavioral Health Services Only program. This will be set up for ensuring those enrolled in Apple Health can continue to access services. For those within Apple Health foster care, such as individuals in foster care alumni, and individuals who receive adoption support, will receive their medical services through Coordinated Care of Washington Managed Care Organization. These individuals will receive their behavioral health services through fully integrated managed care and behavioral health services only managed care organizations. Starting in April 2016, the Healthcare Authority will be purchasing and delivering physical health services, mental health services, and substance use disorder services in a more streamlined way. Instead of navigating up to 3 healthcare systems, individuals in Southwest Washington, Clark and Skamania counties, who are enrolled in fully integrated managed care will receive whole person care in one system through an integrated network of providers. For these individuals, one managed care organization will coordinate to address their physical and behavioral health care service needs. The general eligibility categories for the Behavioral Health Services Only, or BH-ASO program, include dual eligibles, or those with Medicare and Medicaid, Apple Health foster children, foster alumni, and those with adoption support, American Indian or Alaska Natives, individuals who are medically needy or on a spend down, non-citizen pregnant women, individuals in institutions for mental disease or IMDs, and other Medicaid-eligible long-term or residential care, and clients with comparable medical coverage who are eligible for behavioral health services. The Managed Care Organizations, or MCOs, will coordinate care for individuals with Apple Health fully integrated managed care who are receiving their medical benefits from fee-for-service or FFS, or have comparable medical benefits, such as from a Medicare Advantage plan. These individuals will be identified, a signed agreement between their plans will be completed, and data sharing protocols will be completed to ensure coordination of services. The MCOs will track enrollment of BH-ASO foster children, including those receiving adoption support or in kinship care, to ensure adequate coordination of care with the enrollee's providers and foster parents or guardians. When HCA determines a child is in foster care or is receiving adoption support services, it will disenroll the child from fully integrated managed care, enroll them in the BH-ASO, MCO, and transition the child to Apple Health foster care. The BH-ASO MCO will coordinate with the Apple Health foster care MCO to ensure the child is transitioned to Apple Health foster care with minimal disruption in services. Coordinated Care of Washington will coordinate with the fully integrated managed care MCO to ensure continuity of behavioral health services. There will be an array of services that will be available to anyone in the Southwest Washington region, regardless of their insurance or income. These services may be provided by the Behavioral Health Administrative Services Organization, also referred to as BH-ASO. For anyone who is experiencing a mental health or substance use disorder crisis, these services will include a regional crisis hotline, mental health crisis services, short-term substance use disorder crisis services, designated mental health professional or DMHP referrals, and substance use disorder or SUD specialist referrals to involuntary treatment. Within available resources for the region, the Behavioral Health Administrative Services Organization will provide the following services to individuals who are not eligible for Medicaid. Mental health evaluation and treatment services for individuals who are involuntarily detained or agree to a voluntary commitment. Residential substance use disorder treatment services for individuals involuntarily detained as described in state law. Outpatient mental health or substance use disorder treatment services in accordance with a less restrictive alternative or LRA court order, or within available resources, the BH-ASO may provide non-crisis behavioral health services. We haven't previously talked about this in this webinar series. This new information is about crisis services in the Southwest Washington region. The Behavioral Health Administrative Services Organization in Southwest Washington will be one contracted entity that provides crisis services in the region and collaborates with the two managed care plans for Medicaid covered services within the region. There are coordination provisions in these contracts for individuals who transfer, transition, or move to other regions, such as behavioral health organization regions and out of the Southwest Washington region. The Behavioral Health Administrative Services Organization has a separate contract and a separate competitive contracting process than fully integrated managed care, but will work closely with the two managed care organizations in Southwest Washington to meet the needs of the individuals in the entire region. The mental health crisis system is operated by the Regional Support Network today, which contracts with the counties for the provision of most crisis services. Because crisis services are unique in that they must be available to anyone in the population regardless of whether they are on Medicaid, uninsured, or have private coverage, it is important to maintain one single regional infrastructure for the delivery of crisis services. HCA has released a procurement for a single organization that will operate on a regional basis to provide population-based services like crisis services. This procurement is open to any organization to bid. A managed care plan could bid, the county could bid, or any other organization could bid to manage these services. This organization must be operational by April 1st, 2016, at the same time as the fully integrated managed care plans. This entity, which we call a Behavioral Health Administrative Services Organization, will provide initial crisis services such as a crisis hotline and mobile crisis outreach to all citizens, evaluation and treatment services, and SUD residential treatment to individuals not eligible for Medicaid and detained under mental health and substance use disorder involuntary commitment statutes, and conduct all administration related to involuntary commitments, filing petitions, reimbursing court costs, etc. Additionally, there are other functions that the Regional Support Network, or RSN, or county manages today that didn't make sense to divide among multiple managed care plans. The Healthcare Authority has been working closely with the Southwest Washington implementation team to address transition from the current system that manages crisis services in the region as we transition to the Behavioral Health Administrative Services Organization, who will manage crisis services for the entire Southwest region in April 2016. We are currently completing a competitive contracting process for this entity and will announce the apparently successful bidder soon. In addition to managing the crisis system, the BH-ASO will take on some functions that either the RSN or counties do today, including monitor less restrictive alternative, or LRA, court orders for individuals who are not eligible for Medicaid, maintain a behavioral health ombudsman for Southwest Washington region, administer the Mental Health Block Grant Criminal Justice Treatment Account, or CJTA, funds, and juvenile drug court funds in accordance with local plans, and provide limited non-crisis behavioral health services to low-income individuals who are not eligible for Medicaid within existing resources. The Behavioral Health Administrative Services Organization is not responsible for the full continuum of behavioral health services for the Medicaid population. This entity will work with the two managed care organizations in Southwest Washington to coordinate care. The Behavioral Health Administrative Services Organization is responsible for a subset of crisis-related services for Medicaid clients and for providing limited services to individuals who are not eligible for Medicaid within available resources. This entity will also manage certain administrative functions in Clark and Skamania counties. Community Health Plan of Washington, or CHPW, and Molina Healthcare of Washington will administer fully integrated managed care and behavioral health wraparound services. The Behavioral Health Administrative Services Organization, or BH-ASO, will collaborate with CHPW and Molina while providing crisis and stabilization services. Coordinated Care of Washington will administer Apple Health foster care statewide and will coordinate with CHPW and Molina in Southwest Washington, who will administer behavioral health services. Coordinated Care of Washington will also coordinate with the BH-ASO, who provides crisis services in Southwest Washington. Individuals currently covered by Columbia United Providers, or CUP, in Southwest Washington will be transitioned to Molina by January 2016. Some of these individuals may have already received letters about this change. Also, the Healthcare Authority will be sending a postcard in January 2016 to all Medicaid households in Clark and Skamania counties preparing for a change, with more information to follow as we move closer to implementation in April 2016. This is an example of the letter sent to individuals with Columbia United Providers that will be transitioned to Molina Healthcare of Washington by January 2016. Some individuals have already received this letter and have begun to call for more information. This is the postcard that will be sent by the Healthcare Authority to all Apple Health households in Southwest Washington, which is comprised of Clark and Skamania counties, in January 2016. This is the draft version of the letter that will be sent by the Healthcare Authority to all Apple Health households in Southwest Washington, which is comprised of Clark and Skamania counties, in February 2016. Let's do a quick recap of the notices being sent. A number of publications will be sent to individuals with Apple Health starting this month, December 2015. This slide provides a high-level implementation timeline. As mentioned earlier, CUP clients will be transferred to Molina. Clients enrolled now with CUP will receive a letter that explains their transition to Molina effective January 1st, 2016. General information regarding fully integrated managed care, behavioral health organizations, and Apple Health foster care will be sent starting in January 2016. You may be familiar with the cross-agency desk aid shown on this slide. This desk aid shares referral information for several state agency customer service centers, including where and when to contact each agency. We plan to update the cross-agency desk aid in early 2016 in preparation for the healthcare integrations activities noted in this webinar series. We'll share a link to this desk aid at the end of our presentation today. As an aid to you moving forward, we have created a short glossary of frequently used terms related to these healthcare transformation changes in 2016. AHFC stands for Apple Health Foster Care. BH stands for Behavioral Health. As a reminder, behavioral health is the combination of mental health and substance use disorder services. BH-ASO stands for Behavioral Health Administrative Services Organization. This organization will work with the fully integrated managed care MCOs in Southwest Washington to coordinate care for the individuals we serve. BHO stands for Behavioral Health Organization. BH-ASO stands for Behavioral Health Services Only. These services are contained with the fully integrated managed care contract in Southwest Washington and are comprised of behavioral health services for individuals with other care, such as those who also have Medicare. FIMC stands for Fully Integrated Managed Care. These are managed care contracts in the Southwest region that include physical and behavioral health services together. MCO stands for Managed Care Organization. RSA stands for Regional Service Area. RSN stands for Regional Support Network. SUD stands for Substance Use Disorder. Sometimes these services are also called CD, or Chemical Dependency Services. SWWA stands for Southwest Washington. For more information about the topics covered in today's presentation, HCA and DSHS website information is listed on this slide. For early adopter questions, please email HCA at earlyadopterquestion@hca.wa.gov. For behavioral health organization questions, please email DSHS at bhotransition@dshs.wa.gov. A link to the cross-agency desk aid has been added to this resource slide. This video and presentation slides will be posted in 7 to 10 days on the HCA Training and Education website listed on the bottom of this slide. Thank you for joining us today to learn about healthcare integration.
Thanks, everyone. We're going to go ahead and get started with the question and answer session. I'd like to encourage everyone to send in any questions that you may have because we have very few to answer today. So we'll go ahead and get started. First is, will the managed care organization need a different ID card for the BH-ASO members only?
So yes, this is Alice Lynn. The answer to that question is that if enrollees have behavioral health services only, they will get a specific behavioral health services only card from the health plan. So they'll get our Provider One ID card, and they'll get a health plan behavioral health services only card.
Okay, will clients be able to keep their present providers in hospitals and specialists?
So for the folks who are currently enrolled in managed care, the networks are very close to what the networks will be tomorrow. So folks who are currently enrolled in Columbia United Providers, when they move into Molina, or folks who are currently enrolled in Community Health Plan of Washington, the basic set of providers who they have been able to access previously will be the same set of medical providers that they have now. The reason that I couldn't say it's 100% is that there are some folks in medical fee-for-service in Skamania County now who will become managed care, and so not every health plan will contract with the huge variety of specialists a person might see. In some cases, they'll have to look at the health plan set of specialists and see, are all the specialists there, or will they have to pick and choose and prioritize among the specialists? But in general, there will be same network on the medical side. On the behavioral health side, there's a much broader range of behavioral health specialists that will be available to people once they get into the integrated managed care plans.
Will there be a separate handbook for BH-ASO members?
Yes, there will. They'll either get a handbook as a fully integrated member or a behavioral health services only member, one or the other.
Who are the two managed care organizations you were referring to?
So that was a question pretty early in the slide set, and as you saw it towards the end of the webinar, Community Health Plan of Washington and Molina Healthcare of Washington are the two different health plans. And then on the behavioral health services only, we have gotten through our procurement and can announce today that the apparently successful bidder there is the Beacon Health Options. We're very happy that Beacon Health Options is our apparently successful bidder. They have very similar responsibilities in a number of states. They have contracts for Medicaid clients in Georgia, Texas, New York, Kansas. So they have a lot of experience managing a similar set of benefits that they will manage here for us in Washington.
If clients have questions, who should we refer them to?
So depending on the question, it's not too soon for clients to go ahead and call their managed care plans if they have questions specific to the managed care plan enrollment and what the managed care plans will be able to do for them in the new fully integrated managed care system. If clients have questions specific for us here at the Healthcare Authority, it's perfectly fine to call the customer service line.
Will the model presented here be the model used statewide?
The model in Southwest is specific to working very closely with folks in Clark and Skamania counties about particular services, especially on the non-Medicaid, some of the special things that Stephanie talked about that come from federal block grant dollars. Some of those are being kept by the county, and A lot of them are going either to the managed care plans or to the administrative services organization. And for the most part, the managed care contracts will stay the same county to county or region to region as we implement fully integrated managed care. However, in terms of what the counties or the regional behavioral health organization or the county folks who work in that system now, what they might want to hang on to as integration moves forward, that could vary somewhat from region to region.
As a billing clerk, where can I get a copy of the benefits booklet for both types of cards?
So right now, we are just getting through the process of finalizing the booklets. There's a template for the managed care plans to use that we're working on very closely with the 2 managed care plans, and we're also about to finalize the handbook that we send to clients. So those will, when those are all done, I'm pretty sure we'll be able to post them out onto our website. So there's a part on, there's a focus area on our website where publications can be found, and we'll make sure those get up there as soon as they're final.
So will Healthcare Authority provide the model handbook for BH-ASO, and if so, is there a date MCOs may receive it?
Actually, I believe it just went out the door today to the managed care plans. The handbook, the template for the behavioral health services only just went out the door. So again, that's still in draft, but it should be in the hands of the 2 managed care plans now.
To clarify, there will only be 2 insurances after April 2016, or will there still be others?
For Medicaid clients who are currently in the Apple Health plan, there will be 2 managed care plans in Clark and Skamania counties. And so those 2 plans, again, are Community Health Plan of Washington and Molina. Those 2 health plans will be responsible for all the medical services, but Beacon Health Options will also be in those 2 counties helping to provide the crisis service and others that were talked about today. So again, this is strictly speaking for the 2 counties for fully integrated managed care. Again, coordinated care will be serving the foster care clients down there in Southwest as well. So that's a 3rd medical provider of insurance. And then, you know, obviously there's other health plans in the state. We still, as of January, we'll still have 5 managed care plans covering the statewide managed care contracts for the rest of the state.
Okay, so we are about to wrap up our session. If you have any last-minute questions, please send them now. Okay. Will behavioral health enrollees also have access to the private providers contracted by the MCO outside of the public system?
The answer to that is yes, to the extent that managed care plans contract for mental health and substance use disorder services outside of the current providers. Those providers will be accessible to folks enrolled in fully integrated managed care or behavioral health services only. And so again, that's a good question to go back to the health plans to find out which of the non-public providers they are able to have in the network.
Okay, so we're going to go ahead and wrap up today's session. Just a few final reminders. This video and presentation slides will be posted in about 7 to 10 days on the Healthcare Authority Training and Education website listed on the bottom of this slide. Any future